Are you constantly tired, thirsty, or noticing strange changes in your skin and brushing it off as nothing? What if I told you those could be early warning signs of diabetes and you might not even know you have it? Today, we are uncovering the subtle red flags your body is trying to show you before it is too late. Hi there, I am Nicholas, a pharmacy practitioner, and on this channel, I break down medical concepts to help you understand your body better and make informed health decisions. If you are into clear, practical health advice, subscribe to this channel, give this video a like, and tap that notification bell so you will never miss out on future uploads, okay? So let us get right into our today's discussion. So what is diabetes? Anyway, in simple terms, diabetes is a condition where your body struggles to manage blood sugar levels. Normally, insulin, a hormone made by your pancreas. It moves sugar from your bloodstream into your cells where it is used for energy. But in diabetes, this process goes haywire. There are two main types of diabetes. In type 1, the pancreas stops making insulin altogether. In type 2, which is far more common, your cells become resistant to insulin, meaning they stop responding properly. As a result, sugar builds up in your blood over time, damaging your blood vessels, nerves, and organs. Let us focus on to type 2 diabetes for today, okay? Since that's what most people deal with, and many don't even realize they have it. Symptom number 1, frequent urination, especially at night. If you are suddenly waking up several times at night just to pee, that's not normal. Exemption is if you take a lot of fluids before going to bed. When blood sugar levels go up, your kidneys try to filter out the excess glucose. Eventually, they can't keep up. So sugar spills into your urine and it drags water along with it. The result, you are running to the bathroom constantly, getting dehydrated and feeling thirsty all the time. And if you are reaching for juice or soda to quench that thirst, you are actually making things worse. Symptom number 2, visible skin changes. Grab a mirror and check your neck, armpits, or groin area. Do you notice any dark velvety patches? That could be Acanthosis nigricans, a skin condition often tied to insulin resistance. When insulin levels stay high, they trigger growth signals in the skin, especially in friction-prone areas. The skin thickens and darkens, sometimes long before diabetes is diagnosed. Also, take a look for skin tags, those tiny flaps of skin that often show up around the same areas. They are usually harmless, but having a bunch of them could be another clue pointing to insulin resistance. Symptom number 3, frequent infection. High blood sugar makes your body a playground for bacteria and fungi. You might notice recurrent yeast infections, skin abscesses, or even frequent urinary tract infections. Yes, in both men and women. Why? Because sugar feeds these organisms and diabetes also weakens your immune system. Symptom number 4, stiff hands or fingers. Here is a quick test. Put your hands together in a prayer position. Can your hands or fingers and palms touch completely? If not, you might be having something called diabetic neuropathy or stiff hand syndrome. It happens when sugar sticks to the proteins in your skin and tendons, a process called glycosylation, making your hands stiff and painful. Sometimes it gets mistaken for arthritis, but it's really the sugar coating your tendons and reducing flexibility. Another condition is trigger finger, where your finger gets stuck in a bent position and then suddenly snaps straight. That same sugar builds up can affect the tendon's ability to move smoothly. You might even feel a small lump near the base of your finger. Treatment usually starts with steroid injection, but in stubborn cases, surgery may be an option. Symptom number 4, frozen shoulder. Yes, Diabetes can mess with your shoulder too. It's called adhesive capsulitis or frozen shoulder. It causes pain and stiffness that can last months or even years. And again, it's all linked to the same glycosylation process affecting your joints and tissues. Symptom number 6, nerve damage, normally called neuropathy. High blood sugar is toxic to nerves and the tiny blood vessels that feed them, okay? This leads to neuropathy, which translates to numbness, tingling, or even pain, especially in the hands and feet. Now, you may think, numb and feet, that doesn't sound bad. But here's the thing, when you can't feel your feet, you don't notice small injuries. Over time, those tiny injuries, called microtraumas, pile up. Combined with poor blood flow and slow healing, it becomes a perfect storm. Eventually, this leads to Charcot Foot, a serious condition where the foot actually collapses in structure. The scary part, it can happen in less than a year and many patients feel no pain at all. Symptom number 7, infection leading to amputation. Here's a true story. A doctor once treated a patient who came with sepsis and confusion. He had a deep infection on the sole of his foot caused by a regular office staple. He didn't even know it was there. That's how severe diabetic nerve damage can get. Sadly, this is common. A small cut turns into an ulcer, the infection spreads to the bone, and amputation becomes the only option. That's why people with diabetes need to check their feet daily for cuts, blisters, or nail issues. Symptom number 8, digestive problems. Another nerve-related issue is gastroparesis, when the stomach empties slowly due to nerve damage. This can cause nausea, bloating, vomiting, and unpredictable blood sugar spikes. It's frustrating and makes meal planning a challenge. Diagnosis of diabetes. Luckily, testing is simple. We use a test called hemoglobin A1C. This measures the percentage of your red blood cells that have sugar attached to them. The more sugar in your blood, the more your hemoglobin gets glycosylated, just like the tendons we have talked about earlier, okay? A reading of 6.5% or higher means you likely have diabetes. This test is true if it's done before you take a meal or at least 4 hours after a meal. Even if you don't have symptoms, the American Diabetes Association recommends testing every 3 years starting at age 35 or earlier if you have risk factors. Can diabetes be prevented? Absolutely. Here's the shorter version of a prevention, okay? Number 1, eat more high fiber complex carbs. Number 2, cut down on sugar and processed foods. Number 3, exercise regularly. Both cardio and strength training are essential. And if you smoke, seriously, this is the time to quit. Diabetes is manageable, but early detection is everything. So, if you've noticed any of the signs we talked about, or if you are over 35 and haven't been tested, please don't wait. Reach out to your healthcare provider today and take charge of your health, okay? If you want to learn more about what your body may be trying to tell you, check out this playlist right here, okay? Thanks for watching, and I'll see you in the next video. Bye.